from the esteemed Executive Director of the VMC, Pastor Dr. Diola Phillips. And I also thank my mentor and father in the person of Reverend Dr. Chris Oyakhilome. Pastor, thank you, sir, for giving us such a global platform to provide medical aid and relief to those who need it the most all around the world. The aim of this year's conference is to help us discover advancements and innovations in medicine, as well as ways to design and develop effective programs for providing humanitarian aid and support. With more than 134 million people across the world needing humanitarian assistance and protection, and more than 400 million people lacking access to essential healthcare services, according to the WHO and World Bank reports, it is imperative that as Christian health workers, paramedics, volunteers, and students, we must become inspired to think of newer, innovative, modern ways to improve healthcare access to many. And we must also aim to deliver relief assistance and healthcare solutions in a more sustainable manner for today's world. Daniel 12:4 declares the Lord's desire for an increase in knowledge. And we in the Volunteer Medical Corps recognize the importance of applied research and technology in advancing healthcare and development, some of which will be discussed in the course of the conference. Once again, I welcome you all to the 2018 Volunteer Medical Corps online conference. I believe you will be greatly inspired by all that you will see and hear today. God bless you.
Uganda is a country in East Africa. It is bordered to the east by Kenya, to the north by South Sudan, to the west by the Democratic Republic of the Congo, to the southwest by Rwanda, and to the south by Tanzania. Famously called the Pearl of Africa, the official languages in Uganda are English and Swahili. The Volunteer Medical Corps, with her team of passion-driven healthcare providers and volunteers in Uganda, in responding to the health needs in their community, embarked on a free medical mission to provide free health services, including consultation and treatment with medical care, and also made hospital supplies available for patients in health centers in the East African nation.
On behalf of the Volunteer Medical Corps, we want to express our profound gratitude to our man of God, Reverend Dr. Chris Oyakhilome, for launching the Medical Corps in East Africa. And today was our initial activity. We reached out to the community, the school community, and the surrounding communities.
No fewer than 2,000 residents of Kira, Kireka, and Katunga all benefited from the free health services, which included consultation and treatment for common ailments, as well as screening for hypertension, diabetes, eye care, and dental care. Some of the top city officials who were present at these outreach missions had this to say about the importance of the free medical mission by the Volunteer Medical Corps in Uganda.
I would like to thank the Volunteer Medical Corps under Christ's Embassy Church. I want to encourage the church to continue this good service of caring for the body and also for the soul.
I want to welcome you here. This is Kira Municipality, and for the good things that I have heard today with my ears, that you are offering to partner with us as Kira Municipality. I think that's good to round of applause. We have serious challenges, as you have seen. We can see hope now that you're here. We think this is a turning point. We've got partners. We are going to lean on their shoulders to be able to support us.
The beneficiaries were also led to Christ by the zonal pastor, Pastor Luis Osademe.
I know that you're about to go for your supper. I used to be a student like you, and when that bell rings, I hardly hear anything. But I just want you to just listen to me for a few minutes. I'm here to talk to you about Jesus Christ. Say, dear Lord Jesus, I believe with my heart that God sent you to die for me. I believe with my heart that God raised you for my justification. Today, I declare with my mouth that Jesus Christ of Nazareth is Lord of my life. I am born again, and I am a child of God. I want to say this to you. From today henceforth, you will see how that the Spirit of God will begin to minister to you, and your life will never be the same again.
We had a turn-up of about 2,000 people. We provided medical care, dental care, hepatitis B screening. We were screening for diabetes, hypertension, and we also checked the eyes. We had some eye care, and we also had pediatric care. So we are very grateful and excited for today. We've had several people receive medication. So we are very grateful to the man of God, Pastor Chris. We are also very grateful to our esteemed zonal pastor, Pastor Louis Osademe, for giving us this platform to actually provide medical care and also serve God at the same time. Thank you so much.
The Volunteer Medical Corps is a global network of Christian medics, paramedics, students, and non-medical willing volunteers passionate about providing medical care to communities in need and to those affected by disasters. The recent monsoon flood in Kerala, India, created one of such disasters. The southwestern state of Kerala in India was faced with the worst monsoon season till date, which led to severe flooding and landslides. This occurred especially in the northern part of the state, with over 10 districts affected. Over 60,000 people had become displaced as a result of the floods, and many have been placed in relief camps across the state.
My name is Pastor Chuks Mokeme from Pune, India. Firstly, I want to thank our man of God, Reverend Dr. Chrisoya Kilome, for the unique opportunity of having Volunteer Medical Corps in India, and to the esteemed director of VMC. Your passion in seeing that lives are touched all around the world is contagious. I'm proud to be one of those who have contacted that passion to reach out to the dying world. Thank you so much, man. And recently we had a flood issue in India, in the state of Kerala, the southern part of India. And for the first time, we had a situation that has never been recorded for about 100 years, where about 14 districts in the state were flooded. The flood was so much that in some places it washed away homes, bridges fell, and about 400 lives or thereabouts were lost in this incident. We were all moved with passion because we saw the news on a daily basis, how things went. And we, as a team, the VMC team in India, decided we must act and act quickly.
As a response to their need for food, water, relief items, and health assistance, Volunteer Medical Corps, Pune Chapter, set up a relief drive and assembled relief supplies, clothing, and food for the displaced people in Kerala. They provided medical care to both old and young, many of whom expressed their gratitude to the team for their effort.
Now, before we got there, people were already waiting for us. We went there to feed about 200 families. Aid had not gotten to them at that time, so we met hunger, and at instance there, I had to order for 650 kg of rice, apart from all that we've sent in already, because we sent it by train to the place to attend to them. We had clothes in heaps, in sacks. Then we had different kind of foods brought in to be given to the people over there. And then some people sponsored medicines. We had to go with 2 big cartons of medical stuffs that were required immediately at that place. They had no light. Water was a challenge. We had to order water from almost about 120 kilometers away from the city. That was where we ordered water. So they brought it in trucks to that place because the wells were full Some of them use rain harvest and then have purifying system. All of them were polluted and all that, so they couldn't just drink that water. They didn't have anything to drink, so we had to like send in water from another district entirely. But we decided that for us to do this, a lot is required, because Kerala is almost 1,200 kilometers from where we are, which requires we have to fly in. The medical team, we had some local nurses in the community who were able to help us, and the pastors and some of the congregations helped us. And at the end of the day, many were glad. We were able to speak to several of them, minister to several of them in several ways. And of course, they were richly blessed. They received us warmly. We are the solution to a dying world, to a hurting world, that in things like this, we can be one of the first responders in the world. And this is what VMC stands for. This is what we're about. So in every nation, this is what we do. And I know we're building something strong. This is going to grow to be the biggest aid and support system the world would ever see and have. Thank you so much for being a part of VMC. And to all the team from India, you are the best. Thank you.
Warm greetings. My name is Dr. Jumoke Akisonye, and I welcome you, dear esteemed volunteers, to this discussion on advancing innovations in medicine. The Volunteer Medical Corps is a network of both medical and non-medical volunteers who work together in underserved communities and among people affected by disasters to provide relief and medical support, and so we must be up to date with advancement in medicine that will help us achieve our aims. With me here on set are distinguished health and IT professionals who will be discussing the different elements of the broad topic. Our guests include Dr. Chris Otabo. He is a highly skilled medical practitioner, a consultant orthopedic surgeon who presently chairs the board of Alliance Hospital, FCT Abuja in Nigeria, which provides open heart surgery, advanced joint replacement surgeries, kidney transplant, and other cutting-edge medical and surgical intervention. He is also a seasoned public administrator. He will be talking to us about innovative thinking in the design and delivery of healthcare services. You are welcome, Doctor.
Thank you for having me.
Our second guest speaker is a renowned pathologist and researcher in HIV-related cancers, a faculty fellow with the Center for Global Health, National Institute of Health, United States of America, the present director of Plateau State Cancer Registry here in Nigeria, is Professor Gbenga Silas, and he'll be talking to us about latest trends in medical research and innovations in cancer management. Prof, you're welcome on set.
Thank you. Thank you for having me here.
We will also be joined from Austria by our third panelist, Mr. Stefan Rami, and he'll be sharing with us insights into the role of information technology in advancing medical care. He is the Managing Director, Lead Systems, GmbH, Austria. In line with the theme for this year's conference, which is Advancing Innovations in Medicine, we believe that it is imperative that we as volunteers with the Corps begin to think along the lines of designing newer and more innovative means by which we can deliver on our goal to improve access to healthcare and relief materials to those in need and to those affected by disasters. Going to our discussion on innovations in healthcare design, I would like Dr. Chris to please explain the role of innovation in medicine and healthcare delivery. Can you tell us how, we can become more innovative in carrying out our work as health workers and volunteers?
Thank you very much for the question. First of all, I would like to start by saying a big thank you to our mentor, the president of the Believers Love World Nation, Pastor Dr. Chris Oyakhilome, PhD, for his leadership over the years and for showing us the way we should go, and also for galvanizing several thousands of medical practitioners and other healthcare workers to offer their services for free to help millions of people around the world. I also like to thank our CEO, Pastor Dr. Diola Phillips, the Executive Director of the Volunteer Medical Corps, for this innovation, because this in itself is innovation, and for the leadership that she brings to bear on the Volunteer Medical Corps program. Coming to the question you asked me, innovation is a sine qua non in medical practice, because medicine is a field that is ever dynamic, and things happen very fast in medical practice. And so medical practitioners and others who have gotten interest in the medical field must be innovative in order to keep pace with what's happening. Now, I would like to define medical innovation in healthcare as any combination of activities or technologies that provide more value, better outcome, greater convenience, access and simplicity, and all this for less time and cost, both to the patient and to the healthcare practitioner. For instance, there has been some innovations that have shaped the medical world over the years. In the last 100 years or so, the discovery of antiseptics and anesthesia in the 1870s revolutionized the practice of medicine, especially surgical practice, because millions of people were saved from infections that before then used to be like a death sentence. But with these discoveries, people can have safe surgeries and without fear of post-op infections, and then they can have big surgeries without the fear of the consequences of such surgery without anesthesia. Another innovation that is worth talking about is the modern hospital design and the modern day curriculum for medical practice. If you go to a standard hospital today, there are places where you find specific structures, like the theater, the wards, the laboratory, and so on and so forth. The entrance, the accident and emergency, all these as a result of innovative thinking. Then also in the 1920s, one of the greatest inventions in medical history was born, and that's the discovery of penicillin by Fleming. And that changed everything, because bacteria was checked, and so millions of lives have been saved from that time till now. And then lately, in the 2000s and up to date, information technology has come to change the face of medical practice completely. So these are some of the inputs of innovations in medical practice. But medical innovation is not all about discovering new technologies. Getting the healthcare team to embrace best practice is also a type of innovation, like what we're doing here today, talking about things that affect people in their various communities, and how the healthcare workers can come together, think outside of the box to solve peculiar problems. It's also innovation. So I would like to stop here for now.
Thank you so much for that insightful and informative list of innovations that have happened in medicine over the course of the century. Looking at what, thinking about what you've said about concerning innovation and those innovations still impacting lives, centuries after, and is even being improved upon. As volunteer medical corps members, how can we apply innovation in the design that we use in, attending to people in communities where there is disaster, in communities that are underserved, there is no medical facility? How can we use innovation in solving some of these challenges that we meet in the field?
Thank you very much for that question. Okay, innovations can come in two forms. Innovation can be revolutionary or it could be evolutionary. The revolutionary innovation talks about a complete change. It's like you supplant an old idea and you are bringing an entirely new idea. Like for instance, I talked about the discovery of penicillins and new forms of treatment.
Yeah, even quinine changed
quinine, exactly,
how
malaria is treated.
was treated.
Yes, but apart from that, the evolutionary type of innovation where you just simply improve on what is existing before by modifying what is done, and that also brings about significant impact in terms of positive outcome for the patients and the healthcare community at large. So the Volunteer Medical Corps can take advantage of any one of these two. Okay, there are three fundamental areas in which we can, key into medical innovation.
That is, apply them to,
yes,
different communities.
Exactly.
Or sphere of operations.
Yes.
Okay.
First of all, we have to develop center-specific practical solutions, because what is obtainable in an urban center like Lagos, Nigeria, may not be obtainable in a rural community, maybe in the Congo Democratic Republic, or even in a rural village in another state within this country. So Volunteer Medical Corps members must, first of all, identify the peculiarities of their environment and think outside of the box on how to solve peculiar problems within their environment using the available resources. Within that yes. For instance, let's take, for instance, a trauma, transportation of trauma care patients, trauma patients. I've seen situations in which people who have been involved in an accident, they are being cramped into the back seat of a sedan and they are being taken to the hospital. Many of them don't get to the hospital alive because it's not convenient, and partial injuries can become complete, like spinal cord injury. So if we can get an open back vehicle where, even if it is being led by a 2-3-wheeler, put the patient there lying straight, that can preserve the spine and reduce further injuries until the patient gets to the hospital. Then the use of long-lasting insecticide-treated nets and the provision of mosquito net for doors and windows can reduce deaths from malaria by more than 80 to 90%, and that has significant impact on the survival of children, especially, and adults alike in that environment. And also the enforcement of hand washing can prevent communicable diseases, infection, diarrhea diseases in children, and therefore hundreds or thousands of children can be saved just by a volunteer healthcare worker ensuring that children wash their hands after using toilets, and so on and so forth. Then another thing I would like to talk about is patient-centered care. Over the years, things have changed quite a lot in the way the hospital is built. The ambience matters a lot. We must try as much as possible to make the hospital environment as close to what the home looks like. We have to move away from that Nightingale type of beds, hospital ward, to wards that appeal to the patient, that makes the patient comfortable, so that they don't necessarily feel that they are in the hospital, okay? And also, we must create that comfort for both the patient and the caregiver, because many times we care about the patient, but we don't care about their relatives. But it's important that we take the interest of the relatives into account in designing the hospital and where they will stay. And also, in today, it's not necessary for patients to carry their physical folder or keep calling before you can get their medical history. We can have their medical history online, such that if they have to move from point A to point B to access care in another hospital, it will be very easy for a doctor on the other side to just go online and access all the medical record of the patient, and they will be able to continue with the treatment. And lastly, I would like to talk about data. Okay. Data is the next big thing in the future of medical practice. And we must be able to convert data to useful information that will inform decision making in our practice. For instance, I give you an example. As a surgeon, even when I was training in my postgraduate, we used to put drain for every major orthopedic surgery because we thought it would reduce infection. But with research and new data coming out, we discovered that there's no difference. And so we stopped using drains for most of those big surgeries. And that has saved patients a lot of cost. It has reduced time of surgery. It has reduced the inconveniences, and everybody is fine. So if we mobilize data, we can know what works and what does not work. For instance, the use of antibiotics, post-op antibiotics. Before now, some centers use antibiotics for a long period of time, and it has no clinical benefit. So if we know the standard practice, evidence-based medicine, we can be able to differentiate what works from what does not work and stay with the things that work.
Okay, thank you so much. There are 3 things you highlighted on how our core members can apply innovation. And just to kind of give a recap, it's summed up as developing practical center-specific solutions, putting the beneficiary of the health service first, and we should be smart with data.
Correct.
All right, so if you had to sum up all these 3 points, if you had to sum it up in one word, what will that be?
Innovation, innovation, innovation. In the academic community, they say publish or perish. But in the medical community, I would say innovate or be left behind.
Wow.
Yes.
Thank you so much.
Thank you.
All right. Thank you, Dr. Chris.
Thank
now, let's hear from Professor Gbenga Silas. As mentioned earlier, you are a HIV cancer researcher and the present director of the Cancer Registry in Jos. Using cancer research and care as a benchmark, I would like you to describe to our participants the current innovations or trends that we should be aware of as healthcare providers and volunteers, who are involved in making healthcare available to many in today's highly digital world.
Thank you very much, Dr. Jumoke, for inviting me. And first and foremost, I really want to thank and appreciate our man of God and President of Believers Love World, Reverend Dr. Chris Oyakilome. I also like to single out the Executive Director of Volunteer Medical Corps, Pastor Dr. Diola Phillips, for our obvious hard work and innovative approach to things. Innovation, this is the way to go, and innovation has transformed medical care all over the world, specifically amongst patients with terminal illnesses like cancer. And the first to think about is what is known as personalized medicine. Personalized medicine aims with the understanding that every patient that has a particular challenge has things that can be detected and specific for that patient. So I'll give an example of cancers. So it's been noticed and observed that tumor cells are very specific. Personalized medicine technology is being used to identify receptors, proteins, and genes that are very specific to these patients, and therapies are targeted towards it. So this is very important. Following this personalized medicine, a lot of innovations have come out. First of all is the gene therapy. genetic therapy is being used for many cancers. And you also have monoclonal antibodies. Monoclonal antibodies are being used to target cancer cells. Specifically, if you've heard of lymphomas, the non-Hodgkin's lymphomas, the CD20 receptor, very specific on some non-Hodgkin's lymphoma, can be treated using drugs that are specific to CD20. So these antibodies go to target these cells and kill the tumor cells. Right now, we also have some proteins called cytokines that are being used. We have interferons, we have interleukins that are being used to boost the immunity of patients that have cancers. These are innovations. There are also certain molecules called checkpoints. Cancer cells are very evasive, some of them. So we have discovered that cancer cells hide behind checkpoints, certain molecules called checkpoints. Checkpoints are molecules that are on our cells that make our immune system to recognize them as self, so they don't attack them. So these cancer cells go and hide behind these checkpoints. So drugs have been developed that are called checkpoint inhibitors. So they inhibit these checkpoints and make the tumor cells susceptible to treatment. We also have cancer vaccines. Innovations are very important in the area of vaccines, especially in low and middle income countries where access to curative therapies and highly sophisticated treatments are not found. Vaccines are very helpful. Of course, I'm sure you know about cervical cancer and the human papilloma virus. So there's a vaccine against human papilloma virus, the Cervarix and the Gardasil vaccines. There's also vaccine against hepatocellular carcinomas, vaccines against HBV, human hepatitis B virus and hepatitis C virus. So these are prophylactic vaccines, but there are also therapeutic vaccines that have been developed, like metastatic carcinomas of the prostate. We have some vaccines that have been developed right now to treat metastatic carcinomas of the prostate. Very importantly is the understanding of T cells. Tumor cells, especially cancers, are usually being attacked by T cells. Now, these T cells are not specific in most cases to these tumor cells. So the innovation that is on now is to chimerically modify these tumor cells. You remove them from the body, modify them, and make them very specific to destroy tumor cells. This is going on. Now, there is currently the technology called nanotechnology. Nanotechnology has to do with tiny molecules. You are aware that the conventional treatment of cancers that involve chemotherapies, one of the challenges of chemotherapy is side effects, because these drugs are systemic and they are not very specific for tumor cells. So nanoparticles are very tiny, tiny particles in the range of 1 to 100 nanometers that have the ability to go straight to target tumor cells. So this is one very important technology that is being carried out right now. Another very important innovation in cancer management is radiation therapy. Now, we are very aware that radiation, especially ionizing radiation, also causes cancer and could actually kill. So the innovations that are going on right now have to do with aiding this therapy to be able to localize specifically on the particular organ that is cancerous. So you have image techniques that are being used. You have the so-called intensity modulated therapy, which helps to target these cells so that you can treat them and reduce morbidity and mortality in patients. Very importantly, like my colleague has just said, is the issue of data gathering. So right now, there's an innovative way of predicting the outcomes of patients that have cancers. So it's called predictive analysis, which you use softwares to mimic cancer patients at their particular stages and predict how their outcomes will be. Then, very importantly, is surgery. We know that surgery is a very important mainstay of cancer management. But surgery is bedeviled by complications, so bleeding, pain, and the likes. So robotics, the use of robotic surgery is now in the limelight, especially in developed countries. Now, these robotic surgeries are able to go to organs that crude surgery cannot easily go to without damage to other organs. So they are used for surgeries of the urethra, surgeries of the kidney, the ovaries, and fallopian tubes. So these are some of the innovations. Permit me, Dr. Jumoke, to talk about the way to go. There was a conference recently by specialists all around the world, and they were looking at innovations in cancer management in 2030. And so scientists are already doing a lot of work. And very importantly is the issue of personalized cancer vaccines. Personalized cancer vaccines. We are saying that if a patient has a cancer, we could develop a vaccine that is very specific to this patient. How do we do this? We leverage on genetic sequencing. Everybody has genetic genes, and when cancers are developing, they mutate, as they transform themselves, very specifically for individuals. So if we can identify, we sequence their genes, we can develop vaccines that will be able to attack therapeutic vaccines and vaccines that can prevent cancers in such patients. Very importantly is another innovation called oncolytic viruses. Viruses now that are supposed to be causing problems, some of them can be technologically modified such that they can identify cancers in the body and go and destroy these cancers. Lastly, I'll just talk about panomics. Panomics is a molecular biology terminology that has to do with the study of various items in the body that are associated with cancers. So under panomics, you have genomics, you have proteomics, you have metabolomics. So these things are being used right now to look at how we can innovate. So I just like to encourage all our members, both medics and non-medics, to begin to look inwards. And as Dr. Chris has said, you have to localize, look inwards and see how you can localize and domesticate approaches that could help to transform medical care to such an extent that will reduce mortality and morbidity. Thank you very much.
Thank you so much. Dr. Chris, I haven't heard so much of what Professor Gbenga has said. And I like the fact that, you know, he acknowledged our non-medical members. You know, we have engineers, we have accountants, we have those that are in the arts, you know, but they love the humanitarian aspect of what we do in Volunteer Medical Corps. My question to you is that how can they too, this group of volunteers that we have, be part of this innovative direction that we are encouraging everyone to go, especially in the field of medicine?
Thank you so much. Medical care is so big that we cannot leave it to medical practitioners alone. Yes, everybody is needed to inspire innovation and change that would move us forward. And incidentally, some of the biggest inventions, they are not discovered by doctors or medical people. They were discovered by researchers, engineers, people who were not in the core field of medicine. And so for us to have non-medics as members of the Volunteer Medical Corps, it's a very welcome development. And I think more of such people should be welcome on board, because you never can tell where the help will come from and who God will inspire to bring about that innovation that can change the world. So as they listen to us today, I want to let them know that there are many ways in which they can come in to help this cause. First of all, they might just be the director in that office who is required to give that support to that idea, that political support. They could act as advocates for the change that we very much need in our world today, wherever they are. And they can also give moral support to even their spouse or their relatives that are directly involved, and financial support too. And above all, I believe that the reason why this conference is going on is not only to transfer knowledge or to educate the people, but also to inspire in us that change that we need to drive innovation and to break new barriers and set a new benchmark for us in our practice.
Very well said, Dr. Chris. Thank you so much. We'll be joined now by Stefan Rami from Austria, and he'll be talking about the role of information technology in advancing medical care. But before he joins us, I just want us to know that we can send in our questions to our panelists, Professor Gbenga Silas, Dr. Chris. We'd like you to send your question to the contact details scrolling right now on your screen.
Hello everybody, my name is Stefan Rami. I'm the Managing Director of Lead System GmbH here in Austria, Europe, and my specialty is business informatics. I will be talking about the role of information technology in advancing medical care. My appreciation goes to the Director of the Volunteer Medical Corps for the invitation to speak at this conference. Information technology, shortly IT, is the application of computers and telecommunication equipment to store, retrieve, transmit and manipulate data, often in the context of a business or other enterprise. In relation to the healthcare and humanitarian sector, it involves the storage, retrieval, sharing and use of healthcare information, data and knowledge for the communication and decision making. Information technology has been very helpful to the healthcare sector and will continue to play a very vital role in shaping the future of medicine. We will highlight a few innovations that will inspire us to do more research and begin to incorporate their use in your practice and work as volunteers. First, electronic medical records. This form of record keeping, whether in hospital or in outreach location, creates integrated access to all data on the patients or program beneficiaries. This helps to improve the overall quality of medical care because it provides point-of-service information regarding the preventive services, diagnosis, treatment and follow-up. When this is coupled with cloud-based data storage platforms, it creates a better system for data management, analysis and usage. Second, artificial intelligence. The use of artificial intelligence is harnessing and utilizing healthcare data is an emerging trend. The internet has opened up channels for information sharing and analysis, and it would be a wonderful idea to begin to plan for the use of artificial intelligence in diagnosis and management of disease conditions at our centers. AI-guided robotic surgery, AI-based treatment algorithms, vital nursery assistance will become commonplace in our near future. Thirdly, 3D printing. 3D printing is being applied in the production of hearing aids, medical implements and prescription of eyeglasses for patients. Right now, work is presently going on to advance the development of custom-specific prosthetic limbs for those with disabilities. All will be driven by 3D technology. Fourth, wearable technologies. Healthcare apps on mobile devices are becoming increasingly popular globally, and patients' care is becoming more customized and highly personalized. People want to be more involved in maintaining their own health, and wearable medical devices make this very easy for them. It reduces the number of trips to the hospital or outreach clinic, and coupled with telemedicine, they can help us to reach and manage more patients over time at much lower costs. Fifth, the use of drone technology. Currently, health services and medical resources in underserved communities are limited to motor transportation and face-to-face interactions. However, drones are being explored as a feasible option for providing these services in a very more efficient manner. With more research, we can begin to see the application of drone technology in natural disaster relief, search and rescue missions, telemedicine and medical missions. 6. Telemedicine. With the increasing number of mobile subscriptions globally, we should begin to explore solutions that use readily available internet-powered technologies to provide healthcare services to people in underserved communities or remote locations. With telediagnosis, teleconsultation and telemonitoring, we can package programs that increase access to the qualitative and even specialist healthcare services at much lower costs. In conclusion, I personally believe that the positive influence of technology on healthcare is absolutely clear. And when we continue to innovate in this field, we can create a better patient or beneficiary outcomes at reduced cost with a better operational efficiency. Thank you very much for listening.
Thank you so much, Stefan. Thank you for that expose on how we can use information technology in advancing medical care, especially patient care. We would like to take the first question that we have. This is Sarah from Zimbabwe. How do I apply all these new forms of therapy in my community, where I run an outreach clinic for women living with cancer? We don't have access to all these technologies. I think this question is to Professor Gbenga Silas. The question is, we don't have access to all these technologies, and Sarah takes care of women living with cancer in her community.
Well, thank you very much, Sarah, for that question. I guess your community will be having probably a primary health center. At that level that you are in now, because like cancers are very specialized, that needs trained specialists when it comes to treatment and management of cancers. So the only thing that you can do is the area of counseling. You can counsel and encourage patients to, if they are on drugs, to take their drugs. Also the area of education, especially when it comes to prevention. There are carcinogens that are all in our environment, and if you identify those that are in your environment, you could educate on how they could prevent these carcinogens. Then part of education is also the issue that we raised just recently, where somebody is asking whether non-medics can also participate in this volunteer medical corps. Yes. We noticed that sometimes communication between the medics and the populace might be difficult, especially because of their neologisms, their medical terminologies. In a research that was done recently by police, we discovered that the use of those people in the community, especially that can easily communicate through drama and other means, made it possible for us to communicate and transmit whatever we wanted to do concerning cancer prevention and awareness in the society. So just to summarize, what you should do is to counsel them and refer to the immediate higher level for medical care. Cancer management are very specific and need specialized treatment. So you will not be able to do more than that, than counseling them and helping them to take their drugs if they are already on drugs. Thank you very much.
Can I just add to that?
Yes, please.
If Sarah is motivated enough, she can actually bring about some change in that community by reaching out to well-meaning individuals and funding agencies to mobilize funds to set up something that is just beyond the primary care in that community, depending on the population size. She can reach out to donor agencies, and they can actually come and domesticate a cancer center in that place if the population of the women is quite sizable. And that's something that VMC members can do. When you identify a need in a particular community, you can mobilize support to establish something, and perhaps an oncologist can be sent to that place, and or other secondary care services can be mobilized there. The oncologist does not have to be there. He can be visiting maybe once or twice in a month to see those people. And I think things like that can be possible.
Sorry, as an addendum to what Dr. Chris has said,
Mm-hmm.
I think very importantly is her level of specialization. And at that level, what I will encourage members of VMC to do is to look inwards into innovations that have to do with early detection, early detection of cancers. You know, one of the challenges of such rural areas is that because of poverty, lack of education, they present very late. And so morbidity and mortality is very high. But if we can leverage on innovations with technologies that are very cost effective and with low cost, and we can domesticate them in our areas, they could really help these cancer patients because they will detect these cancers at very early age that can be treated. Thank you very much.
Thank you so much for your responses to the question posed by Sarah from Zimbabwe. Now we have another question here from Darish from India. Darish from India is asking, what are the things you look out for in rating the value or impact of regional projects? Dr. Chris.
Okay, Darish, thank you so much for that question. It's so important for us to be able to benchmark what we are doing against the results that we have, especially as we volunteer to our services. In defining innovation, we talked about some key elements. One of it is value. Value must be added, and then time must be saved, and then cost also must also reduce. Okay. These are some of the elements that must be present in true innovations. So the one way in which we measure impact of projects that we get involved with is that we must see positive outcomes. For instance, I talked about the use of long-lasting insecticide-treated mosquito nets for the use of children at home for reduction of malaria. And studies have shown that people who use that net regularly and in the manner that is prescribed, deaths from malaria 80%. Yes, that's one way you can measure impact, that reduction in mortality rate. You can also measure impact by the level of suffering of the people that you are trying to serve. You know, if, for instance, people who have to travel, walk 10 kilometers a day to fetch water, drinkable water, and you provided a borehole by mobilizing funds for that community. First of all, if they were going to stream to fetch water before, that water is polluted and is a potential source of infection. Now, there will be reduction in diarrhea diseases and other communicable and waterborne diseases. And two, they will save time to do other things instead of trekking far distances, you know. And so they conserve a lot of energy, they are healthier, and so on and so forth. So there are many ways in which we can measure the impact of projects in any community. There must be benchmarks that we must set. And before that project is started, we must ask ourselves, what are the deliverables for this project? What questions do we want to answer? What problems do we want to solve? And when the program is running, we can actually do another check to find out whether those questions have been answered, whether those problems have been solved. Thank you.
Thank you so much.
Yeah. Sorry, I would also like to add to that. One of the ways that you can check if a program is effective or not is to also do research. So there's what you call cost effectiveness analysis. For any program that has been introduced in a community, you compare it with the former program or the non-existent program and look at the costs. Costs in terms of the money, the personnel, the materials, cost in terms of person's time that are being used, and you now do cost-effective analysis and see if at a lesser cost you are getting better outcomes. In such, when such happens, then it means that your intervention is valuable. Thank you.
Thank you so much for your responses to that question, and I believe that Darish, the responses have answered your question. I want to thank Professor Gbenga Silas and Dr. Chris Otabo for being very engaging and informative panelists. Thank you so much for the information you have given to us and the inspiration you have given our participants. Thank you so much. And I can only imagine, you know, the new ideas and applications that, you know, we will bring into this world as a result of this conference. You know, as volunteers, health workers, or students, as the case may be, we have the potential to birth new ideas, devices, procedures, and even medicine that can help save many more lives, you know, giving many the opportunity to receive the gospel. There is nothing as powerful as preserving a life destined to death and giving that person the opportunity to be saved. And, you know, for many of our volunteers, that is the driving force, the fact that what we do matter. And in this conference, the focus is in being innovative wherever we are, irrespective of our location, irrespective of, you know, the economic status of the country where we may be or where we practice. The important thing is to, you know, be inspired to do research, be inspired to look at what you have in the environment and make something big out of it. Thank you so much, my excellent panelists. Thank you. Right away, we are going to watch some very inspiring videos, and thereafter we'll be hearing from some of our speakers, and this time it will be on innovations in the humanitarian field. Don't go away.
Spite of